there's no question on TB, then let's talk about pulmonary edema. So pulmonary edema, which is usually a disease that is characterized by accumulation of excess fluid in the lungs, that's in the interstitial and the alveolar spaces, which now leads to impaired gas exchange and also respiratory distress. Usually, the fluid buildup will be as a result of either increased pressure in the pulmonary circulation or increased permeability of the pulmonary capillaries. So sometimes can be called pulmonary congestion or lung congestion or lung water. That's all pulmonary edema. The causes and the risk factors, we have the cardiogenic causes, that is complications of heart-related problems like myocardial infarction, that is heart attack. We have the heart valve diseases, the mitral, the aortic valve diseases, the cardiomyopathy, or other conditions that are characterized by cardiac dysfunction. So we have also severe arrhythmias, hypertensive crisis, fluid overload, valvular heart diseases. All these can be risk factors that are associated with the pulmonary edema. Then you also have the cardiogenic risk factors like the lung infections, exposure to toxins, kidney diseases, smoke inhalation, which damages the capillaries, or going to high altitude areas. So what happens with pulmonary edema? Now, fluid will just build up. Like we said, of course, the cardiogenic causes or the cardiogenic risk factors, mostly which are related to the left-sided heart the problems that we just mentioned. So fluid builds up into the veins of the lungs. And if fluid now is building up in the veins of the lungs, there will be increased pressure in these veins, which is going now to force this fluid out of the vein into the alveolar spaces. And that's once the fluid now is forced out into the alveolar spaces, then it's going to interfere with the gaseous exchange that takes place in the alveolar spaces. And that means that now it's going to affect the patient's, gaseous exchange processes, and that's going to affect the oxygenation of blood and also the removal of the carbon dioxide from blood that is coming in to the lungs for oxygenation. So once now the gaseous exchange processes are affected, then you just think of what will happen. Then patient is going to present with difficulties in breathing because now gaseous exchange is impaired. There is respiratory distress that will be marked by gasping, by labored breathing, by dyspnea, grunting sounds with breathing. That patient produces abnormal short, deep, hoarse sound because now they are trying to breathe as hard as they can just to make sure that at least as more oxygen is oxygenated as much as they can. Difficulties in lying down, the rales, that's abnormal sounds, that's if you do your auscultation. The restlessness, the wheezing, the anxiety, the coughing, excessive sweating, pale skin, coughing up of blood, all that will present in this patient. So for you to determine that, of course, use your stethoscope. That's the only way that you auscultate. Listen to the lung sounds, which you can be able to see either the crackles in the lungs or abnormal heart sounds. If you do a chest X-ray, you'll see now abnormal fluid that has accumulated in the lung spaces. Echocardiogram can still show you of course, the build-up that has happened. This one usually happens now mostly with the cardiogenic, what calls now the cardiogenic pulmonary edema. The cardiogenic, again, which you're talking about now, the other things where we can talk about injury to the alveolar capillary membrane, could be because of acute respiratory distress, the toxic gases that we just talked about, trauma, the high altitude, drug overdose, anything that can affect now the alveolar capillary membrane. And once again, the alveolar capillary membrane is affected. That means now that gases exchange is going to be affected, and that will lead to impairment of oxygenation and lung stiffness. And again, patient will present with the same symptoms. Swali, any question on pulmonary edema? Is it well understood? Why does edema cause crackles during auscultation? Who would want to try that? Why does pulmonary edema cause crackles in the lungs? Yes, Victor, your hand is up.
Yeah, I think pulmonary edema, when there is accumulation of fluid in the lungs, there will be those crackle sounds resulting from the fluid that has accumulated in the lungs.
Okay. Yeah. So actually, like Victor's actually rightly said it, with pulmonary edema, we talked about it being that there's accumulation of fluid in the alveoli and also the interstitial spaces of the lungs. And if there's accumulation of fluid in those spaces of the lungs, they are going to cause or they are going to impair gaseous exchange. So that's why now on auscultation, because of the impairment of the gases exchange, on auscultation now you are going to hear those crackles, which are just, we can talk about them being those fine popping sounds. I'm sure you've had crackles, and if you've not had, just try to check on YouTube what crackles are. So because of the fluids that has filled now the alveolar spaces and those small airways, that's why we get to hear the crackles during auscultation.